Good afternoon.
Welcome.
I'm Sarah Bates. I'm a resident of Austin, Texas, and I am testifying for HB 3376.
Great, thank you.
I'm one of the 1.5 million Texans who would benefit from the Medicaid expansion. According to society, I've done everything that I'm supposed to do. I picked a career that I love, worked hard, earned 2 degrees, and finished school with outstanding grades. When I graduated from UT Austin in May of 2011, I walked across that stage very proud and excited to join the workforce. However, as a self-employed music lesson teacher and freelance oboist, business isn't booming as well as I had hoped, and that's something that a lot of recent graduates are encountering right now. 6 months after graduation, I aged out of my parents' health insurance plan. I did my research and found that there were no affordable plans for me. I was already working more than 40 hours per week, struggling with business costs and merely paying rent, and I honestly had nothing left over. But health issues, especially chronic ones as I have, don't wait for your finances to come together. I still need my medications every day. I need to have my labs drawn, and I need to have access to doctors, even when I'm unemployed. I continuously worry about what will happen if I develop a major illness. I really honestly wish that I didn't need the government's assistance, and I feel that most people in my situation would agree. It's time to see that Medicaid expansion isn't about giving handouts, and it shouldn't be about playing politics. It's about real people, most of whom wake up each day and work as hard as they can. It is difficult to believe that people who are willingly contributing to society are not deserving of affordable health care. Ladies and gentlemen, I feel that the time is now. Whether it is Medicaid expansion or a Texas solution all its own, it's time for hardworking people in this state to receive help. And we are counting on you. Ask yourselves, can you let this opportunity slip by and honestly believe that you have served your people the best that you can? Having no affordable health coverage options is a heavy burden, but I have hope that you, the lawmakers, will find a way to make it possible. Thank you for your time.
Thank you.
Any questions?
Thank you for coming today.
My name is Bettina Cox, and I'm testifying in support of House Bill 3376. I'm a mother and a grandmother from the Houston area, where I've lived and worked for 33 years. Today, I am an ordained and licensed minister at Faith Missionary Baptist Church. Most of my life, I have had health coverage through my job for myself and my family. Several years ago, my daughter, who had studied in early childhood education, and I decided to start a child care center. As entrepreneurs, we were unable to afford coverage in the private market. Things was going well until November of 2011, when my health began to decline very quickly. I began experiencing severe pain in my leg. As I was getting sick, I did not know which way to turn. Being uninsured, the doctors I called were unwilling to see me. One day, my leg hurt so bad that my family and I decided to go to the emergency room even though we knew that the medical bills would be too much for us to handle. It was there that they discovered a grapefruit-sized tumor behind my cervix. It was pinching off the circulation to my leg, and if I didn't have an operation quickly, I would probably lose my leg, or maybe my life. I tried every avenue possible to find a doctor who could help me, and it wasn't until I contacted Gateway to Care that they eventually found an OBGYN willing to take me without insurance and was able to get the surgery and consequently get the help that I so desperately needed. Since that time, I was blessed that, to make a long story short, I was blessed that the type of cancer that it was cervical, and that afforded me to be a part of the program for cervical and breast cancer. I hereby today, because no one should go through what myself and my family has gone through without having affordable health care. I'm reading this one. It's it was very, very hard for us, knowing that we didn't know how the outcome was going to be, and time was at an essence. I didn't have time to be turned down. I needed help, and I needed right away. And I'm just here today stating that, everyone should have an opportunity to have affordable health care, that no family should have to go through the agony and frustration of waiting, trying to find help, and not knowing where the help is going to come from. Thank you so much for your time.
Well, thank you for coming, and we are blessed that you are here today.
Thank you.
Okay.
My name is Alexandra Garza. I was born in Abilene, Texas, and I have a daughter in elementary school named LaSalia. I work at a medical research facility and am currently enrolled in college for medical technology. I was born into a family of athletes. I was raised to eat healthy, drink lots of water, and exercise daily. This lifestyle was ingrained in me, and I believe that it is that kept me free from sickness for so long. But sometimes you can effectively use all the methods of prevention and still contract a virus. In 2010, I contracted a severe case of the flu. Like many Texans, I bounced between being insured and uninsured in early adulthood. After the flu and while uninsured, I began to experience many stints of chest pain and shooting pain down my left arm. One night, the pain was so unbearable that I had someone take me to the hospital and learned that my pulse was 4 times of what it should have been. I was admitted to the hospital and diagnosed with a heart condition called supraventricular tachycardia. Medication provided little aid, and it became obvious that heart surgery was my best option of treatment. When I called my cardiologist's office to pre-register for surgery, I was told that if I could not supply insurance or $60,000 up front, they would not be able to perform the surgery. It was as if my life was worth nothing just because I was of low income but didn't make enough to buy private insurance. I worked but received no benefits through my work. Through my own research, I learned that I could not afford health coverage in the private market, in part because of my diagnosis of a pre-existing condition. I also learned that I earned too much to qualify for Medicaid. I found myself stuck in limbo in a gap where I could not be helped. I was in serious need of heart surgery with no way to obtain it. I felt frustrated, scared, and angry. I am here today only because I live in Travis County, which offers a program called MAP, the Medical Assistance Program. This allowed me to get the surgery I needed, but many other Texans are not so lucky. The Medicaid expansion is important because the current income qualification level for a parent like me to qualify is less than $3,400 a year. That only sets people up for failure and not success. Expanding Medicaid would enable people to work more, make more money, and ultimately reduce the number of people who need assistance. Medicaid expansion would also keep the state from continuing to put the cost burden of the uninsured on counties and local taxpayers. You had made a comment earlier about how you don't think people are crying in bed because they're uninsured, but I respectfully disagree because I was that person. I needed help, and there was no help available to me. It is time for Texas to set realistic income limits for adults in need of Medicaid. Insurance should not be a privilege. It should be a right. Thank you for your time.
I intended to state that healthy people weren't crying in bed. A lot of times it's just like the car wreck situation. You don't need car insurance if you haven't had a car wreck. But once you have a car wreck, you realize
the importance of it.
Yes. Mm-hmm. So I would hope you accept that clarification.
I do.
Question? Thank you.
Thanks.
Okay. Hi, I'm Melissa Knight. I'm a mother who lives and works in Austin. I'm a small business owner. My husband and I have a 3-year-old son named Francis. Due to being self-employed, I currently struggle to find insurance. I do not qualify for Medicaid as the program currently exists, and I cannot afford the costly private insurance options. I am thankful to be relatively healthy currently and feel blessed to be able to go to the Seton Community Clinic and pay on a sliding scale. However, if I was to need hospitalization or any other service not offered at the Seton Community Clinic, I would be out of luck. A number of years ago, I had an episode of vertigo requiring heightened medical attention. At the time, I had insurance and was able to get the treatment I needed. But what if this were to return now, this time without the security of health coverage? That is a frightening thought for me as a mother and the primary caretaker for my son. The future cannot be predicted. I don't know when health problems will arise or accidents will occur. I want to know, just like any parent, that I can provide a stable future for my child. With the expansion, I could receive the health coverage I need to provide security for myself and my family. I urge leaders to consider the hundreds of thousands of self-employed and low-wage workers in Texas who need an option for affordable and quality health care coverage. Thank you.
Thank you for being with us.
Madam Chair, committee members, thank you for hearing my testimony today, and thank you for your service to the state of Texas. My name is Shani Scott, and I am here representing the military families in Texas, across our nation, and deployed around the world. I grew up an Army brat, and my brother served in the Army Special Forces and is now a disabled veteran. I was a military spouse for 12 years, and now my son is proudly serving our country. I came to tell you our story. April 2004, I stood holding my children's hands, surrounded by my military family. It was 0400 for civilians, that's 4 a.m., and I don't even think one of the people standing around me had slept well in over 15 months. We heard the sound of marching, and my heart beat faster. I was about to see my husband, who had been in Iraq since the war began. As the warriors began to fill the room and move into formation, family members were frantically looking for the faces of their loved ones and trying to survive the loss of faces that would not be in the hangar that early morning. As I watched the faces of these great warriors, I started to realize that these were not the same ones who we had said goodbye to over a year earlier. And then I saw my husband's face coming towards us. I was overwhelmed with joy, all the time spent praying that he would come home whole. And I knew the moment that I looked into his eyes, he was no longer the same warrior who left us so long ago. I tell you this story because many of those warriors who stood in that hangar on that cold early morning and hundreds of thousands since have now re-entered the civilian world, many with problems that they and their families will endure for the rest of their lives. There are over 21.8 million veterans throughout the United States. Texas has the second highest number of veterans in this country, second only to California. Over 1.6 million Texans are veterans as of the 2010 census. And in 2011, new veterans faced an unemployment rate of 12.1%, more than 3 percentage points higher than the national average. I will tell you that if states take up Medicaid expansion, many veterans who do not qualify for Medicaid under the current eligibility rules will be able to enroll. More than 600,000 uninsured veterans today have incomes below 138% of the federal poverty line, but only 10% of those veterans, uninsured veterans, are eligible under the current system. A significant portion of uninsured veterans and their families would become newly eligible for Medicaid if states expanded. I'm sure that you already know that a third of our returning veterans have mental health illness that needs help addressing. We know that many veterans receive services through the VA health system, but we also know that many do not. That's based on eligibility. Respectfully, Madam Chair and committee members, this is not a political issue. These warriors stood at the gates of hell defending this country and all of our citizens the right to sleep peacefully at night, kiss your children goodnight, and hold your spouses just a little bit tighter. They did not go to over there to defend only Arizona or California or even Texas. Their benefits should not be contingent upon what state they live in as returning veterans. They protected every state in this great nation. What I know is that it is now our turn to stand guard for our warriors. I want you to remember the hundreds of thousands of warriors that have earned this right for us to have their backs. Will you be standing guard for our warriors? Thank you.
Thank you so much for taking the time to be here today. Thank you. God bless your family, and I also know the spouses that stay at home, pray, and worry sometimes have the hardest job.
True.
So thank you for coming today.
Thank you.
I'm Blake Hudson with Consumers Union. We are the Policy and Advocacy Division of Consumer Reports. I'm here to testify in support of HB 3376. Actually, I want to use my time just to read some stories of people that write into us about their experience with health care, but I did want to give just one more new number that I want to make sure the committee is aware of. If we fail to expand Medicaid, the penalty that employers will face for not offering coverage, Jackson Hewitt Tax Service estimates that'll be about, at a minimum, $299 million more annually. So if this legislature doesn't expand Medicaid, we're going to cost Texas businesses, at a minimum, about $300 million more each year in penalties. So this is probably something to keep in mind as we move forward with this discussion. But like I said, I don't want to go too far into all the other details that have been covered. I just want to read some stories. We get people writing into us about a variety of consumer issues and their concerns and their hopes for legislation and changes on those issues. And I just brought a few of them with me. Charles from Houston, Texas, and I'll read in his words. Charles says, I'm now unemployed after 18 years of steady work, and COBRA is prohibitively expensive since I choose to keep my home and pay my taxes. This is really a nightmare when a person has a chronic condition and needs affordable insurance. Why wouldn't the state of Texas accept federal money? Why cause unnecessary suffering? It's very discouraging when the doctor who has been treating you tells you that since you don't have medical insurance, they won't be able to help you. Stephanie, also from Houston, Texas, she writes in to say, I've been unemployed since May 2012 when my entire call center was closed, and I can't find work. Not one prospective employer has answered any of my online job applications, much less called me in for an interview. My previous employer of 12 and a half years gave us until the middle of the month to use our health insurance benefits before they ended. I got an eye exam and new glasses but couldn't get my yearly mammogram. The COBRA plan they offered us from Aetna was over $2,000 a month. Texas prides itself in being a great state. Prove it. I'm ashamed that my home state refuses to participate in joint federal and state health programs and has wasted valuable time fighting the law of the land. And there's more stories here on the back. I'm self-employed. Robert from Austin, Texas says, I'm self-employed living in Austin, Texas. I've operated a small landscaping and lawn care business for the past 20 years. When I turned 50, health insurance rates became more than I could pay. So I've not had insurance and will need assistance under the Obamacare plan. To date, I've stayed healthy through diet and exercise, but I can't take that gamble forever. It's my job to talk with these people when they write into us and explain to them how their story fits into legislation. And you guys have a chance to help these people, and I get to call them and tell them whether we help them or not. I hope that at the end of the legislative session that we do help them, that we take this opportunity, and I'd be happy to answer questions. Thank you.